It is a sad Saturday morning. You are at a graveyard to bury a loved one. As you leave, sad with grief, you will look around at all of the hundreds of tombstones. You think to yourself that it's so sad that there are so many. Well, that is nothing compared to the millions of unborn children that are murdered every day. If there were a tombstone for every abortion in just the United States, well, we would not have enough room to put them all. So they're disposed of like trash, just as if they never mattered or existed at all. Just think if you could have had the chance to know some of these unborn children that have had their lives stripped away before they even begin. Just think, no one has a funeral for the unborn fetuses. They're not even mourned or missed. So all of the unborn could have been someone you might have had the chance to know, miss, or even love. But we'll never know. Every single hour of the day, all around the world, an unborn child is losing the chance to live. In the case of 1973 Roe v. Wade, the Supreme Court sanctioned a woman's right to choice to determine an unwanted pregnancy. Since that ruling, courts have upheld this decision, with certain modifications over the years. So since 1973, around 40 million abortions have been performed. That is 40 million babies murdered, and no one is doing anything about it. So you think, well, they were not babies yet. They were only fetuses. They might have been only fetuses, but they're all unborn children. At 8 to 9 weeks, the eyelids have begun to form and hair appears. At only 9 to 10 weeks, the unborn child can suck their thumb, jump, turn somersaults, can squint to close out light, swallow, frown, and even move their tongue. If an unborn child can do all of these things, then how are they just a fetus? How can anyone call this morally right? At this early stage of development, suction abortions are performed using a small tube. This is called menstrual extraction. If all fetal remains are not removed, infections can result, requiring full dilation of the cervix and scraping out of the womb. So this is not only murder, but extremely dangerous for the mother, or for the woman, as so are many other abortion methods. Suction aspiration is the most common method during the first 12 weeks of pregnancy. The mother's cervix is dilated, and then a suction or hollow tube with a knife-like edge tip is inserted into the womb. It then vacuums, tearing the fetus and placenta into small pieces, through a tube into a bottle, and discarded like trash. The baby is then thrown away, as if it never existed at all. At only 12 weeks, all arteries are present. The coronary vessels of the heart have blood circulating through them to all body parts. The heartbeat ranges from 110 to 160 beats per minute. Vocal cords are complete, and at times the child even cries silently. The poor innocent soul's brain is formed, and the child can feel pain. At 14 weeks, muscles lengthen, and the mother will soon feel the first of the baby kicking and moving around inside her. At 15 weeks, the fetus has an adult's taste buds. At 16 weeks, eyebrows, eyelashes, fine hair appears. The child can grasp with his hands. At 18 weeks, the fetus is about 5 inches long, and the child can move his or her mouth, and hair grows on the head and body. At 12 weeks, the child can hear and recognize the mother's voice, and even could possibly survive if born. And at this stage, the sex of the child can be determined, plus fingernails and fingerprints appear. At this amazing point in development, dilation and evacuation abortions are performed. A pair of forceps is inserted into the womb to grasp part of the fetus. The teeth of the forceps twist and tear the bones of the unborn child. The baby can feel and even cry, and it is still legal to murder them at this stage. Also at this stage, salt poisoning is done. One of the worst is prostaglandin chemical abortion, which is basically when the mother is given something causing her to contract intensely, which causes the baby to be crushed, if not decapitated, while being pushed out of the mother. Sadly, many have been born alive. Hysterectomy, which is used mainly in the last 3 months, where the womb is entered surgically through the abdomen, and the umbilical, which usually is cut while the baby is still inside. So the baby just slowly suffocates until it dies. The last abortion method, which is overall the worst, is partial birth abortion. The fact that this is legal anywhere is outrageous. The entire body of the baby is delivered, except for the head. The doctor or abortionist grabs the baby by the feet and pulls them out. And the abortionist jams scissors into the baby's skull while it's still in the mother. Once these scissors are open, the suction catheter are inserted to suck out the baby's brains. The remains are thrown away in the trash can. I brought these methods up to show that any type of abortion is inhumane. Whether it is early or late term, abortions must be stopped. The only solution is to reduce abortion rates until our nation comes to their senses and makes abortions illegal. In order to reduce abortion rates, we must do a number of things. Decrease, if not eliminate, governmental funding for abortions. We need to increase availability of birth control and post-delivery tubal ligation. Increasing the knowledge on birth control and pregnancy prevention is extremely important. Also, many women and girls having sex are unaware of what is available to them. Therefore, mistakes happen and they make dumb decisions and end up getting abortions. Decreasing governmental funding only makes sense. Why should our government pay for millions of women's mistakes? Why should our government pay for unprotected sex? And the pure lack of decency for women to put themselves on birth control. The way I think of it is, rudely, if you spread your legs, you should pay for it. Once the government cuts costs for providing funding for abortions, they can put the money towards making birth control more available. Increasing the availability of birth control could help so many women. If the baby is never conceived, then an abortion is never needed. Therefore, way less unwanted pregnancies equals way less abortions. Most of all, I feel that increasing the knowledge on birth control and pregnancy prevention could prevent so many unwanted pregnancies. If our women and young girls who are sexually active are going to be only knew their options, then maybe so many unborn children would not be murdered. If we could educate more women before they have sex, there's no telling what we could accomplish. All I know is not enough is being done to prevent unwanted pregnancies. It is time to encourage pro-life and reduce abortion rates. It is time to petition and lobby for pro-life. Together, we can expose the beauty and the value of the choice of life.